Rady Children's Hospital San Diego and the UC San Diego School of Medicine Department of Pediatrics, you'll find countless ways in which your greatness can grow.
In our region, we serve about 1 million children, adolescents, and young adults. And so to have one center that's responsible for all of those families and all those patients is really a big deal. We take that responsibility very seriously, not only in hematology oncology, but in all the programs at our hospital.
Rady Children's is California's largest children's hospital by volume, with more than 20,000 inpatient admissions and 250,000 outpatient visits in 2019. As the San Diego region's sole hospital focused exclusively on pediatric patients, we care for more than 90% of the kids in our community, which spans more than 60 miles to the northeast and 130 miles to the east, to include southern Riverside and Imperial counties. We are also a referral hub for patients across Southern California and Arizona, and in locations such as Hawaii, Mexico, Guam, and Saipan, providing multiple opportunities to work with non-English-speaking populations. Starting close to home and expanding to strong relationships with pediatric health partners all over the world, our commitment to improving outcomes and amplifying quality of life has a global reach.
We have over 250 new diagnosis oncology cases each year, and we also have extensive hematology exposure for our fellows. So our fellows see many standard diagnoses as well as rare hematologic and oncologic cases.
When it comes to deciding on a research track and thinking about your future, there's so much support for whatever you want to do.
The newest part of our main campus, the Acute Care Pavilion, offers specialized services in a state-of-the-art environment. Rady Children's has every subspecialty represented to serve our patients' diverse and complex needs.
We're close to the border, so you get, kids who come from San Diego, but you also have kids who come from Mexico, and those disorders can sometimes be missed when they're down there, and so you get cases coming in very unique situations, and being able to manage all of that is very helpful.
We care for nearly every child in our community in some way, whether addressing chronic health conditions or managing severe trauma and acute disease, and are dedicated to doing so through leading-edge care and research.
When we want to do deeper investigation, then we partner with research institutes, and that includes UCSD, which has the NCI-designated Comprehensive Cancer Center, but also other institutes in the region, like the Salk Institute, the San Bernardino Prebys Institute for Medical Discovery, the La Jolla Institute for Allergy and Immunology, the Scripps Research Institute, and all of those centers contain major scientists.
Our 104-bed intensive care unit cares for children through events such as complex surgeries, multi-organ failures, and organ transplants. Within this 60-bed Level 4 neonatal intensive care unit, 24-bed pediatric intensive care unit, and 30-bed pediatric acute cardiac unit, students, fellows, and allied health professionals collaborate across disciplines to attend to patients' unique and pressing needs. Just a few examples of Rady Children's intensive care excellence includes housing an award-winning ECMO program and industry-leading Neuro-NICU program, and serving as one of the top neonatal transport destinations for critically ill infants in California and Hawaii. In addition, to help care for our most medically fragile patients, we offer inpatient pediatric rehabilitation services in the Helen Bernardi Center, a skilled nursing and subacute facility that provides 24-hour comprehensive medical care and recreational programming for children with multiple medical, physical, and developmental delays. Between the Rady Children's and UC San Diego campuses, we are constantly striving to revolutionize the way the medical community diagnoses, treats, and prevents illness and injuries in children. The UC San Diego School of Medicine Department of Pediatrics is ranked among the top 10 of its kind in the country for National Institutes of Health funding, fueling many collaborative cross-campus initiatives. With major multidisciplinary research programs exploring areas such as the microbiome, antibiotic resistance, and maternal infant health, We conduct forward-thinking basic and clinical research in every aspect of pediatric health.
I think our fellows really benefit from the research opportunities here, and we really try to help walk you through the research. We don't expect fellows to be able to do the research on their own. We really want to teach fellows the steps in order to be able to carry out whatever type of research they would like to do in the future, and that way when they go off and become a full-fledged hematologist, oncologist, and have their own career, they're able to use all the steps that they learned to carry out their own research.
This allows our trainees to participate in research in any area they choose, including at dedicated centers and institutes such as the Rady Children's Institute for Genomic Medicine. Here, researchers and physician scientists can sequence a child's genome in about a day and potentially apply their findings immediately to life-changing treatment plans. As you hone your skills, you will also gain the important and enriching experience of teaching and mentoring. UC San Diego School of Medicine's entire student body rotates through Rady Children's for their pediatric training, offering a mutually beneficial opportunity to gain new perspectives and build passion for the field of pediatric medicine.
I think one of our strengths as well is our attendings are amazing teachers, our nurses are amazing teachers. The relationship between not only physician to physician, I feel like is very close, but we work very closely with nurses, social workers, other ancillary staff, and one of the things that drew me here was everyone seems to really work together and have a good relationship, and I found that to be a very positive aspect to our program.
And when you need a break from all that learning and professional development, San Diego is ready and waiting with gorgeous beaches, unique cultural experiences, world-class dining, and mountains and deserts just a quick drive away. Talk about work-life balance made easy.
Living in the beautiful and sunny San Diego, where it is 70 degrees outside every day, is definitely a nice bonus too. I can say that I have been very happy with my training here. I feel very lucky to have been here, and if I had to do fellowship over again, I would without a doubt come to San Diego.
We believe the healthcare leaders of tomorrow deserve the very best in training and advancement today. From renowned care and research programs and a deeply rooted commitment to compassionate care for every patient, to engaging learning opportunities and access to some of the best and brightest minds in the health and science fields. It's all right here at Rady Children's and UC San Diego. We look forward to meeting you.